This is a continuation of the brain and spine unit, and the list of terminology for the meninges is in the first recorded lecture of the ventricles. So the whole list for the brain and spine unit is in that first PowerPoint lecture. So for the meninges, we're going to take a look at the three different layers, and the meninges is a layer of membrane that covers all the way down the spine and all the way over the brain. So if you look at this image here of the brain, we're going to go over these in more detail here in just a minute, but the dura is this thicker layer here. It almost appears as two layers, and I always think of dura as the most durable layer. It's kind of the fibrous layer that protects the outermost covering of the brain and spine before you get to the bony anatomy. And then with that, you've got the arachnoid layer, and that's a little thinner layer that's inside the dura. And then the innermost layer is a pia mater, and the pia is this very thin line here all the way around the brain. And between the arachnoid and the pia levels, there's these little fibrous strands that help hold those two layers together, and that is where all the CSF fluid lives and helps to protect the brain and cushion it. Same thing here with the spine. You're not seeing all three layers, but you can see this thin black line here is the dural sac, and it goes all the way down the spine, all the way down to about S2. That's the termination of the dural sac. And we'll take a look at that on the next few pages. So when you look at this image here of the spinal column, and this is the anterior side of the patient, this is the posterior, you have the base of the skull here, and the cervical vertebra, the thoracic, and the lumbar. And you look at the dura and the dural sac that goes all the way down to S2. If we were to talk about doing an epidural injection, sometimes we'll do these for milligrams, or we'll do epidural injection for women who are in labor, then that needle is placed outside the dural sac, and it doesn't look in this drawing like there's much space there, but the dura is actually much closer to the canal, and they would place the needle just outside of that dural sac to inject a medication. But there are times too when they might need to inject something within the dural sac as well. And then if you're talking about a subdural hematoma, like in the brain, sometimes you'll hear about a subdural bleed, then that would be below the dura. So it wouldn't be outside of the dural lining or closer to the bone. It would be inside the dural lining, in between the dura and the arachnoid space. So talking a little bit more about each layer of this meninges, the dura mater is the most outer layer, and it's the toughest. Again, I think of that as a durable layer. It's more fibrous, and it provides a coating not only for the spinal canal, but for all the spinal nerves too that come off of the spinal canal. So that coating goes all the way out each nerve. It also forms the falx tentorum cerebelli, which is that separation in between the cerebrum and the cerebellum, and also the falx cerebri, which is separating the two cerebellar hemispheres. And like we mentioned before, the dura extends all the way to S2. So that's this fibrous layer. In this image here from Netters, you can see that Netters has cut it and then pulled it back, and you can see how it's a much thicker layer than this arachnoid matter, which we're going to talk about next. So this layer is much thinner filament, and it is the middle layer in between the dura and the pia, and it also follows along the same contours as the dura mater. So wherever the dura mater goes, the arachnoid mater is right there bound to it, all along the spinal canal, in the brain, and then along the spinal nerves as well. And it extends to S2 as well, just like the dura. And then the pia mater is the innermost layer. It's much more vascular, and it covers the entire brain and the cord very closely as well. And on the previous image, and I'm going to go back to that for just a moment, you can see that one fibrous strand here is going to be at the end of the conus. So this is the end of the spinal canal here at the lumbar spine, and then the conus is the very end of the spinal cord. And then there'll be one extension of the pia mater that is this one filament that goes down and anchors the spinal cord all the way down to the bottom of the dural sac S2, and that is a filum terminale, and we'll see that on the next page here, filum terminale at the end of the pia mater description. When we take a look at this cord, the spinal cord and the spine in cross section at the thoracic spine or higher, you're going to be able to see the spinal cord and the white matter and the gray matter. And on some images you'll be able to see them better, especially when you have higher detail and higher contrast images. What we see in E anatomy isn't going to be quite that detailed, but so the gray matter is here making the shape of an H. Sometimes it'll look a little bit like a butterfly here in the middle of the cord, and then you'll see the white matter that surrounds it. And you can see the cord is fairly solid here in the thoracic spine, and up higher than that. The cord is a solid cord, not separate fibers. This is the anterior side of the patient in both of these images. You've got the aorta here, and the vertebra, and the spinous process in the back. And so you can see the layers of the meninges here. The pia mater goes directly around the cord, and then you have the arachnoid, which is a very thin layer. They've drawn it in a very thin white line here. And then the dura mater is just outside that. That's this thicker white line that goes all the way around. And so the epidural space, there's some fat in the epidural space anteriorly here and fat in the epidural space here. So that's the epidural space, and then this is the subarachnoid space, and this is where the CSF fluid lives and helps cushion the spinal canal. This sagittal T2 weighted MRI scan from E-anatomy is very nice for imaging the cord and the CSF fluid. This is a midline sagittal image. This is the superior part of the patient and inferior, anterior and posterior. Most often patients are imaged on their back, so lying on their posterior side, which is why the filaments of the cauda equina tend to lie towards the posterior side of the canal. Otherwise, they might be a little bit more free-floating in there. It's very nice for imaging the cord and then any abnormalities within the cord, like a syrinx, because the expanded middle part of the canal filling with CSF fluid would show up very nicely there. You also might see tumors well, although if they're only enhancing tumors and they're small, it might be easier to see that on a contrast enhanced T1 weighted image. And for any injections that they might do for a myelogram or for pain medications and that sort of thing, they can do them up higher up in the spinal column, but they often like to not or to avoid areas where the spinal cord is, and so that's why a lot of the injections are done down here in the lumbar spine where there's cauda equina and just the individual filaments rather than a solid cord that they might run into by accident. The spinal cord extends to about L1 or L2, as it says in the study guide, and then from there is that filament, the filum terminale, that anchors the cord all the way down to the bottom of the dural sac at about S1 or S2, depending on the patient there again. Sometimes there is a lipoma that forms on the filum terminale or on the cord, and it can shorten that filum terminale and pull the cord inferiorly. So I didn't go over this in the beginning when we were looking at this image because we hadn't studied it yet, but I want to review this image because we don't show this as well on some of the other slides. This is the lumbar section of the spinal cord, and then the conus medullaris, which is the very end of the spinal cord, and you can see how that cauda equina starts right below that horse's tail type look, where all of the spinal filaments come down individually. It's no longer a cord, but it's just individual filaments. And then the filum terminale would be just one of those cords that goes down and anchors itself to the bottom of the dural sac, which is around S2. Now looking at the lumbar section of the spine, we are taking a look at the anterior side of the patient here, posterior here. So this is the lumbar vertebra, and this is the spinous process here. Now there are individual nerve filaments. It's no longer a solid cord, but we've gone down inferior to the conus of the cord to the cauda equina. So now we have individual nerve filaments that now go down through the spinal canal. And these are the individual filaments here. You can see them kind of free floating in the CSF. They all kind of congregate in the back, in the posterior side of the patient, as I've mentioned before, because we're scanning the patient on the posterior side. So those can all just free float down to the posterior side of the patient. And then in the middle of this group of nerve filaments here is that pia mater that turns into the one filum terminale and goes down and anchors the cord to the bottom of the dura mater. And here is the Netter's version of that as well. And you can see that they've shown these individual nerves floating a little bit more freely and not congregating toward the back. They're just doing a regular cross-section of somebody. And then they would show the filum terminale right in the middle of the CSF, but that's not necessarily where it always is. It just depends on how the patient is positioned. So that filum terminale will go down and anchor itself to the bottom of the dural sac. This image from e-anatomy shows the falx tentorium cerebelli as well as a cerebellar tentorium. And this is a separation in the dura mater that separates the two hemispheres in the brain and separates the cerebellum from the cerebrum, and also creates the space for the superior sagittal sinus. So, sorry about that. This is a oblique view of the brain, and we're seeing the anterior side of the patient here and posterior here, and this is the separation in the middle, how the dura comes up and folds in on itself. And when you take a look at that on an axial view, so this being the anterior side of the patient, you can see how that dura comes in. It goes all the way around the cranium, but then also folds in on itself, and that creates a superior sagittal sinus. And in a sagittal view, a little bit later on in the lecture, we'll be able to see that as well. So taking a look at these spaces again, you've got the epidural space, and the spaces between the dura and the bony spinal canal. So this is the dura here, and the epidural space is just outside of that dura, just above the dura. And then you've got the arachnoid, and the arachnoid is this thin line here, the green one right there all the way around. And so the subarachnoid space, where the CSF fluid lives, is right in between the arachnoid, and then this is the pia. The thin black line is all the way around. And once again, these are those filaments that connect the arachnoid to the pia mater. And the subarachnoid space is filled with CSF, as I mentioned, and goes all the way up from the brain. The fluid goes all the way through the brain and then all the way down the spinal canal as well. And contrast injections for myelography are injected into that space, not in the brain, of course, but in the spine. So that falx cerebri is the fold of dura that separates the two cerebellar hemispheres. And, sorry, not cerebellar, but cerebral hemispheres. And you can't really see it on an MRI image, but when you take a look at this image, you almost can see this thin filament that looks like it's kind of covering the cerebrum and separating what would be the other half of the brain. And that's that dura mater that comes down and creates that superior sagittal sinus. And the superior sagittal sinus comes all the way up and over the top of the brain. The dura mater also creates the straight sinus that's here. There's an inferior sagittal sinus that runs up over the top a little bit more so, but we're not seeing that on this image. And in the next image, we'll be able to see the transverse sinuses as well that run around the lateral side of the brain on the outsides of the cerebellum. And on the right-hand image, I just wanted to show you this coronal view. So this is the superior side of the patient, inferior, right and left. And this is a really nice view of the falx cerebellar tentorium, because you can see how it creates that sort of a tent, that tentorium there that separates the cerebrum here. So this is the right hemisphere, the cerebrum, and the left hemisphere, and then the cerebellum. And you can see how that creates a division between those two. And this is a superior sagittal sinus right here, this gray area that runs over the top of the brain. Netters does a great job of displaying the falx cerebri and the falx cerebelli so that you're able to see how these divisions are formed in the brain. So in this image here on the right, this is the anterior side of the patient there with the nose and the mouth, superior, posterior, and inferior. And Netters has sliced the bony anatomy in half, so right down the middle of the brain, and then taken out the brain so that you can just see the cavity of the skull on the lateral side. So that would be the patient's right side, and then you can see internally this median dural layer that is created, or that creates, excuse me, a pathway for the sinuses in the brain, the venous sinuses, the superior sagittal sinus, the inferior sagittal sinus, the straight sinus, and then going laterally along the skull, around the right side of the patient's skull here, is a transverse sinus. And that's the venous drainage of the brain going back into the body. And that's a great display of those. It's hard to imagine the transverse sinus from this view, but when you take a look at it over here, you've got the top of the skull, take it off, and you can look down into the skull, and this is the straight sinus here, which is the same one as it is here on this picture on the right, and then the transverse sinus that goes around laterally into the skull before it drops down into the sigmoid sinus and then into the jugular veins, eventually into the jugular veins. So straight sinus, and this would be the right transverse sinus, into the sigmoid sinus that you can't see now because they haven't cut this side away, and then down into the jugular veins eventually. And this is that tentorium cerebelli, or falx cerebelli here. And that's that stretch of dura that separates the cerebrum from the cerebellum.